Okay, welcome. Thanks for joining me today. My name is David Kanashko. I'm a chiropractor, believe it or not, which is kind of good because I will be talking a little bit about specifically why chiropractors should be looking at adding laser therapy into their toolbox. That's really my goal today. So I'm assuming many of you listening in are chiropractors or maybe related professions, but it's a little bit chiropractic centric, you might say, in some portions of today's webinar, but it does apply for most other professions as well. So just so you know, so I'm a chiropractor, I mentioned that, also acupuncturist. I graduated out of Toronto CMCC way back in 1992 and have been in private practice since then and have been involved with laser therapy for over a decade. I'm now the medical director at BIOFLEX Laser Therapy. I consider myself an expert, you might say, in laser therapy, photobiomodulation. I do a lot of training. I speak at conferences, throughout the world on what's now called photobiomodulation. So my goal is always to educate in an unbiased way as much as I can and give you guys some information. So really what I want to do today, many of you are familiar with laser therapy. Obviously, some of you maybe don't know much about it or maybe just read different bits and pieces. I know I didn't get much information back in back at CMCC because actually back then there wasn't really much known about it, to be honest. That was really part of the curriculum. So I'll talk a little bit more about how laser therapy works, and then I'll address how it would be used in a chiropractic practice as far as what are the main things that we're seeing our patients for and how that might be useful therapeutic tool. And then probably very importantly, I'm going to talk about the evidence, relevant clinical trial research, publications and guidelines. There's a lot of them, believe it or not, actually more than spinal manipulation, if you can believe that. And a bit about our equipment. This is where, I'm trying to make you guys understand what makes our equipment a little bit different with respect to maybe some of the competitors and so forth. And then we'll always have time for a Q&A at the end. I encourage you to ask questions along the way, preferably in the Q&A box. The chat box, you can sort of chat amongst yourselves. In fact, if you would like to, I would love to know where you're from. And if you are a chiro and perhaps you're interested in laser therapy, if you care to let me know, that would be really appreciated. So let's talk a little bit about the terminology. A lot of chiropractors and practitioners use the term cold laser therapy or low-level laser therapy, that kind of nomenclature. And there have been a lot of names over the years, and it's gotten confusing. And sometimes clinicians aren't quite sure if it's the same process or same therapy or what have you. And I think there's been over 70 plus documented names in literature that have been used. So the world authorities, the North American authorities, they actually decided to come up with a more accurate term that has been accepted by PubMed as a MESH term. MESH stands for medical subject headings. And the terminology that was decided was photobiomodulation therapy, or PBMT. So that's what's now is typically used in published peer-reviewed research. I think as a clinician, I'm going to stick to laser therapy because it's easier and people kind of more than likely have heard about that terminology. But, I just want everyone to be aware of that. So the acronym that had been used a lot was LLT, or low-level laser therapy, but that wasn't a MESH term. So in part because it didn't encompass other forms of light, including LEDs or broadband light or some other sources of light, because this phenomenon and how it heals isn't strictly related just to lasers. And I'll talk a bit about that as well. So if you're interested in research and you want to say, hey, I want to know what kind of research there is on low back pain and laser therapy, I'd recommend you use PBMT or So you go or LLLT in PubMed, and then and neck pain or and low back pain or whatever it is you're interested in. And that will pull up the vast majority of research that's available. So by definition, laser therapy or photobiomodulation therapy is a form of light therapy that uses non-ionizing forms of light. So it's very safe. There's no concern or risk at all for tissues, unlike, say, ultraviolet or X-rays, obviously. And the sources of light can be from a laser, LED, broadband light, as I mentioned earlier, and it's going to be in the visible and near visible or infrared spectrum. Most importantly, it's a non-thermal process. I know a lot of you out there might wonder about class 4 laser therapy or see lots of stuff on class 4, which is a thermal type of laser. And oftentimes they'll advocate or they'll promote class 4 laser therapy as equivalent to photobiomodulation, but it's not, and really revolves around the fact that they use so much energy that it's beyond the therapeutic window that's been established by really thousands of papers. So if you want photobiomodulation therapy, your diodes should be less than 500 milliwatts if you're using lasers, right? So if you have 1 or 2 or 3 laser diodes, that's fine, but they shouldn't be causing heat. In other words, you should be able to place them on the skin, push into the skin, and hold it without burning your patient. If you can't do that, typically it's a class 4 and you're going to burn it. So it's a distance away from the skin and you move it around. There might, depending on the wavelengths used for class 4 and how they move it around, you may be able to, achieve photobiomodulation with a very quick amount of dosage, but it, unfortunately, because it's at the level of the skin and it's not there for very long, it's really not going to create that photobiomodulation effect that's documented in all of the research, which references under 500 milliwatts, just so everyone's aware of that. The overall outcome of this type of therapy is really designed for beneficial therapeutic outcomes to reduce pain, reduce inflammation, modulate the immune system. That in part goes with reducing inflammation, but probably most importantly is it accelerates tissue healing, promotes wound healing and tissue regeneration and repair. And that's really one of the key aspects of why a chiropractor would be looking at adding laser therapy. The origins of it go back into the early 20th century by Dr. Niels Finsen, who used filtered light, red, ultraviolet, and some other infrared wavelengths to treat skin tuberculosis and smallpox, mainly affecting the skin. And he actually won the Nobel Prize in Medicine and Physiology for his work. So he's really the father of using artificial light for therapeutic purposes, and that's referred to as phototherapy. So that's kind of where the origin was established. And then when lasers came around in the 1960s, a physician out of Hungary, Dr. Andre Mester, was kind of fooling around a little bit with red lasers, and he was trying to use a high-powered red laser to remove some tumors. And his laser that was made for him at the University of Budapest in Hungary, it was calibrated much lower than what he thought it was going to be. So when he tried to treat these tumors, eradicate these tumors, he did incisions and put in the tumor cells. And what he noticed was instead of eradicating the tumor, the incisions were healing faster and the hair or the fur grew back faster on the abdomen compared to the control. So upon this, he was quite perplexed as to what was going on, and he realized that his laser, in fact, was calibrated much lower, but that didn't explain why the hair grew back faster or the incisions were healing faster compared to the control. So he decided to do more experiments, specifically skin flap wounds, so much larger wounds. You can see the bottom here are the control, and then he irradiated one specific wound, skin flap wound, over the same time frame with the red laser, that lower powered laser that he had from his first experiment, and he observed that wound was healing indeed faster than the control. The other thing I want everyone to understand is that what he observed also was the adjacent wound next to the laser treated one also was healing faster, you can see, compared to the control as well, even though it wasn't touched directly by red light. And so that's important because he concluded there's two effects going on: a direct effect of light. Somehow he didn't really understand the mechanism back then. This was in the 1960s. Red light seemed to be accelerating wound healing, but the effect was mediated in the blood or circulated around to the adjacent wound. So there's some kind of systemic and what we know now as remote effect. And to be honest, if you want really good results with photobiomodulation therapy, you want a direct effect on tissue healing, and you want a systemic effect, which promotes immunomodulation of white blood cells, helps reduce inflammation around the area, and can reach deeper tissues where light can't penetrate. So that's where treatment time is critical, because the more blood you irradiate, the better systemic or remote effect that you'll have. There's even equipment out there, the intravascular laser therapy, where you use fiber optic needles and actually insert it into a vein, and you kind of like chelation therapy, which is also really effective as well, but it's invasive, and unless you happen to be a phlebotomist or you have that scope of practice, you can't really do it as a chiropractor. That's also the equipment. There isn't much equipment around for that as well. So again, difference between hot lasers and cold lasers is hot, obviously create a high temperature. They can carbonize, vaporize, coagulate proteins up to a certain zone in the tissue, right? So this is where you get tissue damage. That's referenced as HLLT, or high level laser therapy. And then they observed a zone outside of that, so deeper, when light was being directed at tissues. And that zone is a photoactivation zone. Now we refer to that as low-level laser, low-level light therapy, and now is photobiomodulation. This is it causes cellular activation and is obviously atraumatic. It's not going to cause any tissue damage. So to understand how photobiomodulation works is we need to understand the concept of photoacceptors or chromophores. The easiest way to explain that obviously is in a plant, where chlorophyll is a photoacceptor for sunlight, and it converts photonic energy, into chemical energy. So it's a photochemical reaction that occurs in order for the plant to take the energy of the sun, convert it to energy that the plant can use to grow. There's lots of different photoacceptors in humans, like for example, melanocytes. They absorb lots of ultraviolet radiation, hence why melanin it protects our deeper layers of skin from damaging ultraviolet, for example. There's hemoglobin, myoglobin, all sorts of different chromophores or photoacceptors that absorb light, right? But the most important chromophore, or the critical chromophore for photobiomodulation, is found within mitochondria, and specifically along the electron transport chain, and even more specifically, one of the terminal enzymes of the ETC, cytochrome C oxidase. If you've read a little bit about laser therapy, you probably know that that's sort of the target for the light, is within the mitochondria, and this enzyme CCO, or complex 4, as it's known in the mitochondria. So essentially, this involves aerobic respiration. You need oxygen. Oxygen binds to CCO. You need glucose. You need a proton gradient chain as well. And this will convert the energy will be converted from ADP into ATP, ATP being the energy currency for the cell, in order for cells to regenerate and repair. And let's face it, when our patients come in and they have an injury or issue or whatever, we need tissue repair and regeneration to get them along their way and healed. So really how it works, this is a kind of obviously a pictograph of the electron transport chain on the inner membrane of the mitochondria. So you can see the different enzymes along the way. And normally what happens is you have a proton gradient pump that eventually will help produce ATP. This cytochrome C oxidase has copper and iron subunits in it, where oxygen binds for this process to occur. What happens in inflammation is you have an increase of intracellular nitric oxide. It's a byproduct of inflammation. Nitric oxide has a higher affinity for copper and iron within the subunits of cytochrome C oxidase. So basically it outcompetes oxygen. By doing that, it inhibits or slows down aerobic respiration, and therefore ATP levels start to decline. When you get ATP levels declining, the cell will either undergo triggered apoptosis or cellular death. It will go quiescent. Of course, it won't undergo mitosis as well. And so the ability to regenerate and repair is inhibited. And we don't want this. We want to promote, obviously, that. So our job as our chiropractors, obviously, is to work on patients and physiologically get their nervous system improved, mechanics improved, all those kinds of things, and help deal with inflammation as well. So how laser therapy works is quite interesting. So light has a certain amount of energy, right? It's photonic energy. It's housed within the photons. Remember, energy never disappears as it's converted into different forms, right? So it's known by the active absorption spectrum, research that was done in the 1970s, that certain wavelengths of light are absorbed preferentially in this enzyme. They're absorbed by copper and iron. And the energy from these wavelengths can break hydrogen bonds between nitric oxide and copper and iron. So as you're bombarding these mitochondria with red and near-infrared wavelengths, the ones that tend to be less absorbed by other photoreceptors and absorbed by this specific enzyme, then the nitric oxide will dissociate off the copper and iron subunits. Now, nitric oxide has a very short half-life, 5-6 seconds. It's also freely diffusible through the membrane. So what happens is, as you're bombarding these cells, nitric oxide is dissociating off, allowing oxygen to bind back on. Now you start to get some ATP generation, but nitric oxide is critical also in the fact that it can have secondary effects. It can cause vasodilation if it diffuses through the cellular membrane into the extracellular space and the blood, right? Or actually within the cell itself, nitric oxide can cause, in certain concentrations, a positive effect inside the cell. It's only if it's high concentration. So when you get little spikes of nitric oxide, it actually can cause positive effects. It's a weird kind of molecule. It can be inhibitory. It can be actually promoting good things as well. It just depends on the concentration levels. So end of the day, but bombarding it with these wavelengths of light, you're going to promote the ATP production within the cell, and this will allow the cell to undergo cellular respiration, and will have all sorts of different effects. I've kind of labeled it here so you can see that there's primary, secondary, and tertiary and quaternary effects that really relate to ATP production, nitric oxide release, and then if you delve even deeper, you can talk about redox signaling, transcription factors being affected, and eventually these effects can be felt in the distant cells. That's that remote or systemic effect, and that's how we're starting to see photobiomodulation being used, for example, post-concussion syndrome. We're doing a clinical trial right now in 2 sites for post-concussion syndrome using laser therapy. The light can't really go very well into the skull, but it can mediate it systemically. So you can see actually quite positive effects with that as well too. So remember, there's 2 ways it works: directly. So if I have tissues that are injured, you can get light to the injured tissues. You can help heal those tissues by these mechanisms I just mentioned. And of course, indirectly, if you treat the blood and or bone marrow, there's ways of doing that as well. I'm going to mention a couple. Then you can stimulate the systemic remote effect that really has a powerful anti-inflammatory effect in the general area that you're treating. So imagine doing this instead of say patient taking an anti-inflammatory pill or something of that nature. It's that powerful. In fact, most research shows it's as equivalent, if not better, than non-steroidal anti-inflammatory drugs. Some of the systemic effects that have been noted, including reduction of prostaglandins, which we know is a major inflammatory mediator. It can reduce inflammatory cytokines, increase anti-inflammatory cytokines. I talked about nitric oxide release and white blood cells. Actually, the numbers of white blood cells increase when you expose tissues to photobiomodulation. It can also promote the release of cortisol, mast cell degranulation, increase the activity of macrophages, which is important for clearing up and helping tissues repair as well. And it can help with reducing pain in different ways, including the release of endorphins and enkephalins, and even blocking nociceptor pain as well. But you use that in a different way. That's why class 4 is quite popular, because it blocks pain very efficiently, but you can only do one or the other. If you want to block pain by blocking nociceptors, you need a really high dosage. So class 4, the patient will feel great, but it's temporary. The dosage is so high, you don't actually get a photobiomodulation effect. For that, you need much lower dosages. Pain relief comes more with endorphins and enkephalins and anti-inflammatory effects for the most part. Now, the systemic effect is critical, and a lot of practitioners they don't really know about this, and they just think about, okay, I'm going to put a laser on there for a few minutes and you're good to go. But systemically, it's critical to treat for longer periods of time with lower dosages, because that's what will promote this anti-inflammatory effect. This experiment will show is one way to demonstrate that. The lead author is actually at the very bottom there, Yuri Oron. I know his name's at the bottom, but he's the head guy. I know him personally. He's a researcher out of Israel, and Tel Aviv, and he's done tons of research. And this particular paper is fascinating. What he did was he used pigs, and he inserted a catheter, a balloon catheter, and he blocked a coronary artery. And I think it was one of the ventricles. And he caused a myocardial infarction. And of course, there were controls as well. He also treated the bone marrow of the ilium, so the hip, and the tibia in some of these pigs as well. And so what he found was that the pigs that were treated with laser therapy in the bone marrow, so they did this directly in the bone marrow, had significantly less myocardial or myocardium muscle tissue damage, 68% less damage. So if you look at the actual, I don't know why my slide's not advancing, there you go. So if you look at what was going on the left diagrams here, the first circle is the tissue damage post myocardial infarction from the balloon catheter with no laser. The same, different pig, same balloon catheter myocardial infarction. By the way, you're looking at the white scar tissue, right? That's the tissue damage. And then if you look at the corresponding pig that was treated with laser, not near the heart, in the hip and the tibia, look at the white scar tissue. It's barely noticeable. It's up to 68% less tissue damage and scar tissue when they were treated in the bone marrow. So what he concluded and what he observed and what he actually objectively measured was that there was an increase, a substantial increase in circulating stem cells and white blood cells. Of course, these will be attracted to areas of tissue damage and help them heal faster. So net result here is, if you want good results, I mean, obviously going in the bone marrow is the best, but you can go over the sternum to get bone marrow. The sternum's pretty thin, so you can get light into the bone marrow, but also just treating blood itself, especially the first 5 millimeters, 6 millimeters of tissue where there's lots of blood, you'll actually will get a systemic reaction as well, because all that blood has stem cells in it, and they have white blood cells. So they're all interacting with light, and they can create a really good positive systemic effect as well. He did this experiment in humans as well, but instead of drilling a hole and being invasive, he did it just on I think it was a tibia. And these were people that had heart attacks, were being rushed into the hospital. Some of them got laser therapy. And what he noticed, they observed there was not dramatic results like this, because they didn't get it into the bone marrow, but they still found decreased creatine kinase, and tissue damage markers were decreased when they treated externally over the bone marrow. So it still did something, which is quite amazing. So I know he's doing more research on that as well. One really important thing to mention here is that photons of light, they bounce off skin. So the idea with laser therapy is you want to touch the skin to minimize the reflection up to 85% loss. You don't want to be shining and moving around because you're going to lose light. So if the target's relatively deep, and when laser light hits skin, it is no longer a coherent beam anyhow, it just scatters everywhere. So people sometimes get a little confused by that, but a laser is just a powerful light. As soon as you touch the skin, it's no longer a coherent beam, it's scattering everywhere. It just happens to be very intense light. So that's important to understand as well. Remember that if you want to increase the light to the depth of where it's going, you can increase the power up to a point before it gets too hot, right? Or increase the treatment time, which allows more photons of light to get deeper as well, kind of like watering a plant as well. So remember, the ideal situation is not to hold the light above the skin unless you're treating an open wound or something of that nature. Most of the time, you're going to be touching the skin to allow light to go into the tissue, and even preferably depress the tissue. So equipment should be designed so you can depress and push the diode into the skin, and this will allow more light to go even deeper. So imagine depressing 1, 2, 3 centimeters into tissue. Now I'm 1, 2, 3 centimeters closer to my target, like the sciatic nerve or whatever it is you're treating. So again, you should have equipment that's designed to allow you to do that, not a large glass plate with the lasers behind it or what have you, or a ball rolling around. You can't really do that very well. To some degree you can, but not as well as a single tipped probe. Light penetration for red lights, roughly 10 millimeters, give or take. For near infrared, it's a little bit deeper. Hard to say how many, but probably several centimeters, 3, 4, 5 centimeters, maybe 6 centimeters. Lots of factors there, including the tissue density, skin color, fat, all these different things. So you can't say exactly the greatest depth of penetration, other than the deepest penetration is going to be in the low 800s. That's a fact. Don't debate me on that. That's what the research and science says. Not 900, not 980, not anything else. It's shown conclusively that anywhere in the low 800s, light's going to go deeper. Okay, that's just a fact. As you go higher, it's absorbed more by water. Water has a absorption profile of high 900s and 1,000 plus nanometers, kind of like how a infrared sauna works, right? Those wavelengths are much higher typically because you're targeting water. One wavelength that might be important is 980 because you can change the conformation of water molecules, and this may have an effect on other channels or actually shapes of protein. So that might be effective, but it's going to be a little bit different. They're doing lots of research in that as well too. So the other concept we should understand is pulsing the light. I won't go into any details, but when you pulse the light, have it on and off, just like a strobe light, the effects are better because you allow the cell to utilize the energy and not overstimulate the cell as well. I can talk hours about that, but I don't have the time. The last thing you need to understand is there's a therapeutic dosage window. Too little light does nothing. Too much light can inhibit, right? So there's a therapeutic window, usually measured in joules per centimeter squared or joules per point. And that can range from 5 or 6 joules to maybe 7, 8, 9, 10 joules of energy. It all depends on what you're trying to do and what you're trying to treat. But if you're above or beyond that, the effects won't be as good. So you need to know what you're doing. So how does it help with your patients? It's going to do lots of different things. As I mentioned, it's going to help with improved circulation, reduction of inflammation, help with nerve healing, muscle healing, collagen formation, bone formation, and so forth. As far as chiropractors go, well, I mean, we treat lots of those things, right? Facet irritation, torticollis in the neck, disc herniations, muscle spasms, strains. This is all spinal related stuff, the arthritis, stenosis, SI syndrome, all these things that we treat on a daily basis. You know, you do your adjustments, and that's going to be helpful. But if there's acute inflammation going on, it's great then to throw on the device, let the patient relax for 10, 15, 20 minutes, and get some stimulatory effect directly in the tissues as well. That's why doing a combination of the two is going to be even more effective. And I can show you some research, and I will, that shows that as well. Disc herniations, neuropathies, everything from intercostal neuralgias and other forms of neuralgias like trigeminal neuralgia, TOS, nerve compression syndromes, doesn't matter where it is necessarily. Nerve healing is quite effective for that. And of course, all the soft tissue injuries throughout the extremities and areas of the body. I don't need to spell them all out to you guys. You're fully aware of what those are. It's all very helpful. It's also evidence-based guideline to treat lymphedema, post mastectomy surgery lymphedema, but other forms of lymphedema, whether it's a sprained ankle or what have you, very effective for vasodilation of both lymphatics and regular blood vessels as well, and having an effect on the immune system. So again, very helpful for patients where there's swelling involved as well. Evidence-wise, I don't know, a few months ago when I did a PBMT or LLT search, it was 7,700 research papers, give or take. Every year there's 500, 600, 700 papers being published on PBMT. So it's being really well researched, especially the last 5, 6, 7, 8 years or so. If I look at clinical trials, you can notice here I clicked off clinical trial. Every year there's maybe, I don't know, 150, over 100 clinical research trials being published every year. So overall, there's over 1,500 clinical trials. Typically, they're randomized, placebo-controlled. So some of them that we can relate as chiropractors. In the Lancet, there was one on neck pain. It was a systematic review meta-analysis, and they looked at 16 randomized control trials. It's by Roberta Chow. And actually, I know her. She's spoken at some of our events. About 820 patients were in these trials, and they basically concluded that at the time they were using LLT, this was I think in 2009 or 2010, it reduces pain immediately after any acute neck pain and up to 22 weeks after completion of treatment in patients with chronic neck pain. So in other words, a follow-up showed that it was quite relevant and quite helpful for long-term relief of pain and symptoms with neck pain, which, by the way, let's face it, there are some CIs for manipulation in the neck. Some patients don't want, I don't know how many patients I've had that said, just don't touch my neck. I mean, we all get that, right? So end of the day, they don't consent to manipulation. You're not going to do manipulation. What are you going to do? Mobilization, stretching, blah, blah, blah. This is a great therapy, especially in acute neck pain, where maybe they're just too resistant or too much in pain for you to even manipulate, which can happen sometimes. So it's a great form of therapy as well to add to that. This paper was published at JMPT, which I'm sure all of you know, and it was chiropractic manipulative therapy along with LLT for cervical facet dysfunction. It was a randomized control trial. They chose 60 women were treated. I don't know why they just used women, but whatever they did, 18 to 40 years of age. I think they did 6 treatments over 3 weeks, so twice a week. And there was a spinal manipulation group only, diversified regular treatment up to 3 joints that were adjusted. So very nice and specific. And laser therapy only or combination of laser and chiro or spinal manipulation. And what they found overall, I won't go into all of the details, is that if you just did spinal manipulation, it was helpful. We know that. If you just did laser therapy, it was helpful. I know that. If you did them both, the results were even better. End of the day, right? So that's what they concluded with this particular paper. Other evidence-based guidelines, for example, the Annals of Internal, got to be careful how you pronounce that, right? The Annals of Internal Medicine by the American College of Physicians and Surgeons. This was published a few years ago. Actually now, gosh, 5 years ago. Time flies. And so they looked at different ways of treating low back pain that were not prescribing medications. Congratulations, physicians. You understand how to treat low back pain without prescribing medications. And they didn't actually give any form of modality that had enough evidence to treat low back pain. They did mention manipulation, thankfully, and hands-on therapies and exercises and movement therapies, all that stuff that we know that's helpful. The only modality that was actually had enough evidence was low-level laser therapy. They did also mention acupuncture, but I don't consider that a modality, right? So that was published as well. Very recently, in fact, November 4th of this year, the Centers for Disease based out of Atlanta, Georgia, so this is USA based, they published guidelines for prescribing opioids. So what they're trying to get these doctors to do is say, hey, okay, you got an acute patient, lots of pain, very short duration of opioids. If you need to do that, never prescribe them in subacute or chronic is what they're saying, and only make it a short duration if you're going to prescribe these meds. We want you to do these other things that we know are effective based on the research, right? And that's basically, they did these recommendations based on the research. And so for low back pain specifically, they recommended low-level laser therapy, no other modalities. They recommended spinal manipulation, of course, massage, makes sense, mindfulness-based stress reduction, yoga, acupuncture, multidisciplinary rehab. These are all things that everyone is probably doing already. We know that. Well, maybe not doing laser therapy, but you should be, because it is evidence-based at this point. What is this from? Oh, right. Sorry. I had that on a timer. This was for knee osteoarthritis, and there was a meta-analysis for LLT, or low-level laser therapy. They looked at 1,000 patients, 22 trials, and they concluded that laser therapy reduces pain, but most importantly, reduces disability in patients with knee osteoarthritis. So this is just more on about this. This is British Medical Journal, by the way. I'm running out of time, so I kind of speed things up here. The electrotherapeutic modalities Cochrane collaboration review looked at frozen shoulder. The only modality that they found was effective along with exercise was laser therapy. They did not recommend any other form of modality. Okay, our equipment, we've been around for 30 plus years, right? We're one of the first manufacturers of laser therapy devices in North America. We're well established. We produce professional equipment. Now we produce consumer grade equipment. And really what makes us and sets us apart really is our equipment and our clinical support. That's end of the day what it does. Our story goes back over 30 years with Fred Kahn. Some of you may know the story, may not. He had a shoulder injury, went to Cairo back in the late 80s. Don Fitzritzen that had a archaic red laser from Russia, and it helped his shoulder heal. So he got interested in it, and that's our history. We make lots of different devices. They've morphed and changed over the years. Now we're getting into a little bit nicer, newer equipment, and we have all sorts of stuff in the pipeline. Pretty exciting for us. But the things that you need to understand is that we've been around, and we've been, obviously in media, from Nature of Things, David Suzuki, to Norman Deutsch on neuroplasticity, featured in all those kinds of things. I was down in Los Angeles for the Rams NFL team. I was training their medical staff on our equipment. Don't blame me for how poorly they're playing. It has nothing to do with our equipment. They have tons of injuries, including concussions, all the rest of it. But, our equipment's getting out there and being used more and more, in part because how it works is we have class 3B lasers, as most manufacturers do, but we also have these large surface arrays of light. And really they're designed to promote the systemic or remote effect around the area that you're treating. These are on for about 12 minutes or so over each area. and the laser probe is used for a few minutes at a time. So treatment times would vary from 15 minutes or so, depending on what equipment you have, to maybe up to 30 minutes if you need to treat multiple areas and you're only using one device. But our devices now, you can use 2, 3, or 4 devices at the same time, where they emit red, the near infrared light, and then the laser probe. That's kind of the treatment approach that we do. The first 2 steps basically are promoting more of a anti-inflammatory and a stimulatory effect, and the class 3Bs are targeting the injured tissue directly. Billing wise, you're going to bill it similar to how you might bill other additional therapeutic services in your clinic. Whether it's shockwave or acupuncture, you're not doing that for free. You're adding that into your treatment fees, right? So as a standalone therapy, if a patient comes in, you're treating knee osteoarthritis, just going to do laser therapy, then that treatment might take 15 minutes or 30 minutes. It depends on what equipment you have, to be honest, and exactly what area you're treating. Or you may bill, a short treatment time or a long treatment time, or bill it by the minutes. That's really up to you. Typically, you see it billed out at $50 to $60 per 30 minutes, so you can do the math. But obviously just check to see what other clinicians are billing, and you can kind of figure that out. Since 90% of our treatment time is hands-free, you don't need to be there with the patient, nor does your assistant. You just need to get it up and running and then go do your work on other patients. So most chiros can, work on 2, 3 patients at any given time. I got a little freaked out treating more than 3 people at a time, to be honest. I was more comfortable with kind of 2, but I don't know, maybe some of you treat more than that. Probably do, but I was always a little slow. So laser therapy can be administered in a standard chiropractic treatment or modality room. You can move it on a cart. You can put it in a stationary area. Usually the patient's sitting or lying on a table for treatment. So that's kind of, you can have a designated room, or you can just use it in your regular rooms. Our systems are pretty mobile, so you can either just, move it around on a cart, or some of the systems you can just carry and walk around and do what you need to do. As I mentioned earlier, treatment time varies. On the minimum side is around 15 minutes. On the maximum side, 30 minutes. So if I'm treating the entire lower back, 30 minutes maybe. Again, though, that would depend. If I had 2 arrays at the same time, I could get it all done in about 15, 16 minutes or so, 20 minutes. Depends what equipment you get. Treatment plans, same as chiro, right? Acute 3 times a week, and then see how they're doing or whatever, down to twice a week, once a week, and then maybe maintenance kind of care for progressive issues like arthritis or that kind of thing as well. So the key things here is why I would say laser therapy is a very good entity or therapy to add to your practice. Is it accelerates tissue healing directly in the cells. I've shown you and demonstrated that. It's a well-known established fact. It can help your patients reduce pain and inflammation. That's a good thing. It's non-invasive. That's a good thing. No chance of any injuring your patients with it, and it's evidence-based. It's a standalone. Our equipment is basically standalone, 90% unattended. So that makes it easier to adapt into chiropractic. You can treat tons of extremities easily with it. Shoulders, knees, ankles, or whatever. Put it on there, walk away, do something else. Pretty easy to do. So you can actually try and promote that side of your practice as well. If you're not doing a lot of extremity work, pretty easy to do. It's a proven therapy. It's been around a long time. The few contraindications for patients, and increases treatment options that these patients might be contraindicated for spinal manipulation, as I mentioned earlier. Obviously, you guys are entrepreneurial. You need to make some money off it. It does offer a pretty excellent return on investment, helping your bottom line as well. And as far as our company goes, what we pride ourselves on is our clinical support. Call us up, email us up anytime you want. Well, except when I'm eating dinner and sleeping, but even then I might even answer. And how to support, you might have a patient going, I've never treated trigeminal neuralgia. What do I do? And I go, well, did you watch my webinar on that? And you go, no. I can say, okay, fine, that's what you do. And obviously ongoing CE educational events as well. like today. And in December, we have a webinar year-end review on all the interesting research in photobiomodulation, if you're interested in that. We do events called Light Up Your Practice. We did one in person a couple of weekends ago. Next one's online, December 3rd, 9 to 12. If you mention my name right now, I'll get you in for free. You can just give us a shout and we'll get you in there. And I do lots of other training events, advanced certification training, master classes. I've done them all up for this year, and we'll be posting our new schedule for 2023 pretty soon. That is it for today. You can reach me at david@bioflexlaser.com. I am not a salesperson. I'm the medical director. So if you have sales inquiries, you can email me, but I'll push you on to an account executive. They're quite knowledgeable. So I don't mind doing that. I don't know if you have any questions. So our equipment is certified for use in United States, Canada, Europe, Australia, South Africa, and about 50 countries. So most areas around the world we can sell to and support as well. Okay, that's it. Thanks so much. I really appreciate everyone's time today. Not a lot of questions here, I must say. That's okay. I don't mind that. What else? That would be about it. Have a great day. Happy Thanksgiving. If you are in United States, my phone number, by the way, is 416. Someone's asking this. 416-251-1055, extension 126. I don't even know my extension number. 416-251-1055, extension 126. But the number is on our website, so feel free to find it there as well too. And that is it for today. Have a great day, everyone. Happy Thanksgiving to our American friends south of the border. Take care, everyone.